beautiful. Yeah, guys. So I'm talking about painful sex. Yeah, the causes, the treatment, how to go about it, everything you need to know about painful sex. Yes, painful sex is medically known as dyspnea, dyspnea, dyspnea. Not good with words. Dyspnea. Dyspnea simply means pain during or after sex, like a few minutes after sex. But majorly people feel the pain when the the penis is inside. When people feel pain. So painful sex could be as a result of different things. It could be as a result of underlying untreated infection that's probably like present, and maybe infections that you refuse to treat completely, or you'll be treating it but you did not treat it completely. That's also a factor. So yeah. So basically, number one cause of painful sex is vaginismus. Vaginismus is like fear of getting hot. It's a psychological problem, psychological effect. It's a problem, yeah, and it's a mental problem where you have fear of anything touching your vagina, because you fear that you get hot. Not that you will naturally get hot, but then you have the fear in you that you will get hot at the end of the day. It's psychological thing. You can see a sex therapist rather, or have a sex session, or watch porn, or do all those kind of things to like um you know um calm you down, erase those thoughts from you, or just like work on yourself and all. The second cause is vulvodynia. Vulvodynia is the over sensitivity of the vulva. The vulva is the outside part of the vagina, the surface. Yeah, that's why it's always advisable to wear cotton underwears that will not irritate your lady parts. Mm-mm. That's kind of underwear you want to be seen wearing. And another cause is STI, yeah, sexually transmitted diseases. I mentioned that infections, diseases. You need to treat any form. If you've had any form of infection before and then you still have pain, that could be as a result. Like it could be those infections that are causing it for you. And then yes, vulvodynia. Concerning vulvodynia is also people who are circumcised also suffer from vulvodynia. Yeah, vulvodynia, because the clitoris has been cut off, so it's made them very highly sensitive, and then these people do not just enjoy sex, and it is really disheartening. Like it's really disheartening, but there is a management, not total cure, because I won't lie to you, there's no total cure for people who are circumcised and they have pains. There is no permanent cure, but then it can be managed, it can be improved. They can train themselves to enjoy it. Okay, yeah. Although people say it's not me. Oh, they say if you are circumcised and you do not enjoy sex, just like drug yourself, drug yourself, drug yourself and get high, so you won't even get the feeling, you won't feel anything, you get so high. But it is not advisable because drug is not good for your health. You can like get overdose or something. So I do not even advise that. But it can be managed if you detoxify frequently. You detoxify frequently. You keep your vagina, your lady area clean, healthy, and neat and everything. And then you also have this confidence about yourself, have this confidence about your body. You are, powerful. Say things to yourself: you are sexy, you are all, you are divine, you are everything. It also helps to like improve your sexual life. And always make sure that your partner is aware. Yes, like let your partner be aware of these things. Like let him know you've been circumcised, and then he needs to go You know, you have to be patient, you have to be gentle, you have to be calm, you have to treat you like the baby that you are, baby girl. So you have to like, like take you slow and all. Yeah. And that also helps. It helps you like when you receive the love and care, when you look at your partner during sex, and then fine, you feeling pain, but then you're looking at him, so it makes things so smooth and soft and easy to go, right? Like, it, even the pain, you forget the pain, you think about the love you have for your partner majorly. Think about the love you have for your partner, you think about how your partner loves you and how you really want to like, satisfy your partner because you really love him and you want him to like enjoy every part of you. So in that case, that being said, yes, we also have PID, that's pelvic inflammatory diseases. PIV is very common, very rampant. People with painful sex suffer from this pelvic, because like the pelvic area has been shifted as a result or has a certain infection. And I'll keep mentioning it. Our infection package, the detox tea, the infection app, those two, do not joke with it. Do not joke with it at all. Do not joke with those two package, because it is everything. It works perfectly well. It treats infections that has been reoccurring, like you've tried orthodox conventional medicine and it's not going. Please settle for herbs. Yeah. Settle for herbal. This herbal will treat it permanently, and then you won't have any form, like you won't experience it again after this complete permanent treatment. Okay. Yeah. So at times, the reason why some people also have painful sex is as a result of medications. Probably the drugs they are taking is drying them out. Like this happen naturally, like it dries them out. So all you have to do is just to like stop the medication, give the medication. After stopping, give it for like 1 week for things to come back to normal. And if your sexual condition does not like come back to normal, then you know that you have to like do something. You have to like come to meet me, do something, right? Okay. Another problem is some people have pain during sexual intercourse as a result of menopause. Like for elderly people, menopause, like when you are getting to the stage of menopause, like that's for people within the age of 42 to 45 down. Some people it can be very early for them. Yeah, the age of 42 to 45, menopause stage, you will have sexual, like it's likely for person to suffer from painful sex, because the vagina will be mostly like dry, like it's getting old. But then there are supplements you can use. There are supplements that helps to boost the vagina. I always say this thing that most of these treatments, most of these our health is mostly from inside, and it's always very advisable to use supplements. Even for your skin, use supplements. I have an acne prone skin. I break out a lot. I've been able to manage this using supplements, skin supplements from inside out, because breaking out, all these things, they are from the blood. Like you can't apply cream to your blood, right? So they are from the blood. You have to use all these things. You have to use supplements. So there are estrogen supplements you can use. You can just hit me up on my DM. I can recommend estrogen supplements you can use, or get them delivered to you if you want. And yes, I noticed, I don't know whether it is only me, but I had a discussion with some of my friends, a client that came around, client friend, and then I don't know whether you experience pain immediately after like your period, like during the last day of your period, probably after your period, and then you have sexual intercourse. You notice there's pain. That kind of pain, it's okay. It's actually like it is accepted, right? Because when you finish your period, your menstruation, at that point, the walls of the vagina will tighten up back, like it will tighten up back, and then by the time when you're having like sexual intercourse again, your vagina will like kind of like open, and when vagina is tight and then you're opening it, you feel pain at first. At times it gets wet and you get dry, rather get dry. So that's all. And if you experience frequent vaginal dryness, you are not using any, you've checked the causes. It's not like you are suffering from vulvodynia, you're suffering from maybe medication or it's period, and then you have consistent vaginal dryness. Please, you need to detoxify. You need to detoxify. At times all you need is just detoxification. Get your body alright, get yourself alright. Mentally, at times mentally you don't, at times you don't feel in the mood. You have to get in the mood. When you don't feel in the mood, it's natural, it's normal for not to feel in the mood. You are a woman, we are all humans, and it is okay for us not to feel in the mood at a certain point. It is fine. But it is when it's like consistent, like it happens all the time, that's when it is bad. And then you need to like consult a doctor, you need to consult your gynecologist for real treatment and all. Yeah, so yeah, there are lubricants you can use. I always advise to always use water-based lubricants. Water-based lubricants. Oil-based is not bad. You can use oil-based lubricants, it's not bad, but water-based is the best, because water-based like is going with the condition of your vagina, right? So it's condition of vagina going with condition of the discharge. Most of the discharge is water-based, not really oily. So if you use water-based lubricant, it reduces the rate at which infection or anything can happen, right? Yeah. I've talked about um menopause, vaginal infections, medications, vulvodynia, vaginismus. Yeah. Now, for people with vulvodynia, excuse me please, who is vulvodynia, that sensitivity of the vulva, people with that issue, you can also use estrogen cream. There are creams, estrogen creams. You just like use this cream on the surface of your woman area, of your lady area. You use it there to, you know, like reduce the sensitivity of the vulva, reduce sensitivity of your vagina, and then makes sex more pleasurable in that way. Yeah. And fine, you have to always discuss this condition with your partner. Your partner needs to be aware. You cannot be suffering the gentle guy. Please don't say, don't do that. Don't suffering the calm man. Don't suffer him. Let him know your condition. I know some people might run away. If they run away, since they don't like you, they don't love you. Because if I tell you my problem, you say you love me, I tell you my problem and you're running away, it means you do not in the first place. I just want to like chop and run away. So yeah, so you just have to like inform your partner about your condition. Let them know that this is how you are, this is what happened to you, and all that. Yeah, I think I'm done with my points. Yes, and at times all you need is just like resolve resolve the guilt, like resolve it, like internal conflict. If you're having internal conflict with yourself, just like settle it. It can affect your sexual life actually. It might not be the drugs, it might not be um the thing you think it is. It might be you, it might be internal conflict. Like, you know what internal conflict is? Like, you are battling with yourself, or probably you're not angry about what your partner did. Just always sort it out, like settle it, talk about it, like always be vocal, talk about things. As a female, you shouldn't be quiet. Like, you're powerful, you should not be quiet. You should always like talk, always say this is what I want, this is how I want it to be. You are powerful, you're a queen. Come on girl, you are a queen. So you need to get this thing straight. You need to like let your partner know. You need to settle, you need to revolve, you need to solve. You need to resolve internal conflict. You need to solve internal conflict. You need to talk about it. You need to talk about feelings regarding, like, you know, past abuse. You need to talk about it, talk to someone about it. And that's it. I hope this video has been very helpful. I hope it has been helpful. I don't know what I'm posting this on my, it's really long, it's 40 minutes, gosh. and I made like some video. I'll try to edit them, sure. I'll just edit them and put some. But guys, subscribe to my YouTube channel because this video will be on my YouTube. Make sure you subscribe, and returning subscribers, thank you so much. Thank you, thank you, thank you. Thank you for sticking by us, despite the fact that I've not been dropping videos frequently, but you are still here with us, and I'm grateful for that. Yep. So please don't forget to subscribe. If you are just like dropping by this video, please subscribe. Love you.